So another classification of hematuria or blood in urine based on causes, right? We could say that there's blood in urine because there was a damage to the glomerulus. Or could say that there's blood in urine, but the problem is not from the glomerulus, okay? And that's why we say non-glomerular hematuria, okay? So like we have a glomerular hematuria, all right? We have already made a video on that already, okay? So look at this non-glomerular hematuria. We'll go from the definition to the causes, go to the characteristics of this disease condition, look at the possible evaluation, look at the possible management that would have been done. So this non-glomerular hematuria, it actually refers to what? Blood in urine, but this one originates from other sources other than the glomeruli. Now, note this. The glomeruli is part of the kidney, but the kidney also has other parts. So if it is originating even from the kidney, but from other parts other than the glomeruli, it is still non-glomerular. Okay? We have other parts such as what? Kidneys, ureters, bladder, urethral. Okay? Now, what could be the causes? It could be that there was a kidney stones, right? It could be urinary tract infections. It could be trauma to the kidneys or bladder. It could be tumors, and these tumors could be malignant or benign, right? These tumors could be found in the kidneys, could be found in the bladder, could be found in the urethra, right? It could be as a result of cysts or abscesses in the kidneys or bladder, right? It could be prostate issues like what? Prostatitis, that's inflammation of the prostate. It could be benign prostate, what? Hyperplasia, right? It could be urethral strictures or injury, okay? It could be medications like the person is taking some medications like anticoagulants, aspirins, and all that, right? Then characteristics, that's basically the features of this disease condition, right? There's absence of red blood cell cast in the urine. There's normal or near normal red blood cell morphology, all right? Hematuria, this type of hematuria could be persistent or intermittent, right? Then evaluation now. That's basically to dictate the condition or monitor the condition. You might want to do urinalysis just to dictate the hematuria. You might want to do urine culture test just to rule out, right, infections. You might want to do imaging studies like ultrasound, CT scan, and you are doing this just to what? Visualize the urinary tract, okay? You might want to do a cytoscopy just to examine the bladder and urethra. You might want to do blood tests just to access kidney functions and rule out other possible causes, right? So this answers the big question. What is hematuria? It's basically what the condition in which blood is present in urine. It can either be gross, that means it is visible to you, or it could be microscopic, okay? So what are the possible managements for this? If there's an underlying cause, you might want to treat the underlying cause. Like for example, if it is due to infections, you might want to use antibiotics to treat the urinary tract infection, right? Then you might also want to monitor kidney functions and urine output. You might want to address related conditions like if it is a prostate issue, you address it, right? Then you refer the person to a urologist or a nephrologist, okay, because these people have specialized knowledge on the urinary system. So you might want the patient to actually what? Receive specialized treatment, right? Then you follow up the patient till the hematuria is what? Resolved, right? So that's non-glomerular hematuria, right? See you guys.